Hey everybody, talking a little bit more about surgical treatment options for Morton's neuroma. And I've got two main ones that I really enjoy doing, and particularly this first one, I'm just finding it giving really good outcomes with very minimal time off of our feet and very minimal pain post-operatively, whilst just getting straight back into work, school, or otherwise as soon as we can. And that's a deep transverse metatarsal ligament transection. Basically what we're doing is we're releasing that ligament that goes in between the two metatarsals of where the neuroma is to try and decompress that space. And typically that's undertaken under local anaesthetic in rooms, only needing Panadol and ibuprofen post-operatively, and patients are back into their joggers around that 5 to 7 days post-operatively. So that's a really, really good outcome for my patients that would otherwise be in a shoe for potentially up to 4 weeks after neurectomy, and only then potentially getting back to their standing work. And so this type of procedure is really good, typically giving 80 to 90% success rates there. When patients either have a very large neuroma, so typically over that 10 to 15 millimeters, or they're having persistent pain after the previous procedure, that's when I'll take them through for a neurectomy or a nerve removal procedure. And typically we'll do that through a dorsal approach, move some of the structures out of our way, identify that nerve and its two tributaries through to the toes, and remove that nerve as well. It's a very good option, and it is the gold standard in Morton's neuroma as per the research in fixing that Morton's neuroma. However, I am really finding that that minimally invasive deep transverse metatarsal ligament transection is a really good outcome or really nice procedure to get a good outcome really quickly for my patients. And it's definitely something that I talk to all of my patients about because it's something that we can put into place, particularly if they've got prolonged pain that's resistant to any of all of our conservative options. But hopefully this has given you a little bit more information about those. Love to hear your comments on this. In the meantime, hit the subscribe button, have a bit of a look at some of our other videos, and we'll see you in the next session. Cheers.